Welcome back. He's arguably the most targeted man in the California legislature, receiving racial insults, death threats. This past week, even shoved from behind on a sidewalk outside the California Capitol. He's Dr. Richard Pan, member of the California State Senate, representing part of Yolo and Sacramento counties, and the author of Senate Bill 276, which is designed to increase childhood vaccinations. Thank you very much for joining us.
Thank you so much for having me here.
That video, it got some play this past week. You weren't hurt, but it's somewhat disturbing.
It's very disturbing because it's an escalation of the hate and violent rhetoric that has been directed not only toward me, but toward any public health advocate who supports vaccination. And so now we've gone from rhetoric to an actual physical assault.
And I understand bricks are being mailed to co-sponsors of the bill.
Well, bricks were being mailed to assembly members who had to decide to...
was saying, do not vote for this.
Correct, but certainly you can do that in a letter. Sending it on a brick sends a very negative message.
So 276, this is the bill that you've introduced. It's passed out of the state Senate,
Correct.
Now being considered by the state assembly. What does it do?
Well, what the bill does is closes a loophole where there are physicians out there, a very small number, who are essentially selling medical exemptions. We expected...
To vaccinations.
To vaccinations, correct. So we expected the physicians to exercise their professional judgment in accordance with the standard of care using the evidence. But unfortunately, there's a small number of physicians who have decided to advertise exemptions. They're giving them for cash, sometimes without ever examining the patient. And the real danger is that over 100 schools in California right now have medical exemption rates way beyond what you'd expect, over 10%. Those schools are now dangerous because those schools do not have vaccination rates high enough to protect the children who attend those schools from an outbreak.
What would your bill do to correct that?
What my bill does is that physicians would still be able to write exemptions, but those exemptions would be reviewed to ensure that they are consistent with the standard of care. And if a physician was writing a large number of them, the medical board could also examine that physician.
Reviewed by whom?
Well, actually reviewed first by public health physicians at the California Department of Public Health. And if the parents wish to appeal the decision by those physicians who work at the Department of Public Health, it would actually go to a panel of practicing physicians who would basically say, is this what a reasonable physician would do? And if they said yes, then they would get the exemption. If they say no, then the exemption would not be issued.
A lot of folks very much opposed to this bill because they believe several things. One is that they argue that you're denying the family, the patient-doctor relationship. They have a doctor they go to, they have a child, the doctor knows the child, they can make the best decision based on whether that child should be vaccinated.
I'm a pediatrician. I take care of patients. I believe strongly in the doctor-patient relationship. In this case, oftentimes the families have actually even said on social media, my child's doctor won't give me a medical exemption. Where can I buy one? That's not the doctor-patient relationship anymore, right? The other thing is that when you go see a doctor, you can still decide whether you wish to vaccinate your child or not. That's still your choice. What this bill does, because when you send your child to school, this is about a medical exemption. When you send your child to school, the school has a responsibility to see that not only your child, but every child in the school is safe, right? When you send your kid to school, you want to know that that school is safe. So when someone brings a false medical exemption, inappropriate medical exemption, and there's too many of those people together, then the school is no longer safe, especially for the people who really need the medical exemption. If you really need a medical exemption, you need the rest of the students, the kids in the school, to be vaccinated to protect your child. So we need to protect the children who actually need medical exemptions.
Right, but they say, listen, you have Robert F. Kennedy Jr., you have a number of movie stars, certainly celebrities, who make the argument there is a nexus between vaccinations and the rise of autism. Is there any evidence to that?
No. That's been thoroughly debunked. There have been numerous studies looking at this. You should be listening to scientists, not celebrities, when it comes to the science. Every major medical, public health, and scientific organization around the world, not just in the United States, around the world agree vaccines are safe and effective, and we need to maintain vaccination rates high enough to protect our entire community.
If you're going after the doctors who are allowing for these unlawful, essentially, exemptions, why shouldn't that take care of the problem? Why do you need your bill then?
Well, actually, the problem is that if you have too many kids who have medical exemptions in the school and some of them are inappropriate, that puts every child at risk, including the ones who really need the medical exemption. We need to keep those kids safe. Now, where did those kids get that inappropriate medical exemption? Yes, they got it from a doctor, so we will go after them. The medical board will now have the tools they need to examine what they're doing and address that issue. However, the first priority has to be keeping our kids safe at school. This is fairly targeted. This bill only applies to students attending schools where the vaccination rates are already below the level necessary for protection, that 95%, which is necessary for community immunity. But ultimately, it is about keeping kids safe.
Senator Richard Pan, a Democrat from the Sacramento area, thank you very much for joining us.
Thank you. Thank you so very much.
We'll have some final comments after this.